Hello everybody, welcome back to our channel. We are super excited because today we're sitting here with Dr. Odette Suter, who actually wrote a very interesting book called What Your Vet Never Told You. And we would really like to talk with her today about the 6 pillars of longevity that she speaks about in her book. And I would say, let's get right to it.
All right, well, thank you so much for having me. And it's a pleasure to kind of spread the word, and I appreciate so much what you guys are doing because, that's what we need.
Thank you.
Is, to get it, the information to the masses. So anyways, yeah, I talk about the 6 pillars of health because, in the traditional world, we're kind of educated to just have a pill for every ill type of thing, where we don't really look at the underlying cause. We just find a band-aid for whatever issue is present. And so in my book, I write a little bit more about what it will really take to turn life around and turn health around, or keep the animals healthy for, longer. And so basically, the difference between holistic and traditional is that we find the root cause, and traditional is maybe a little bit more helpful for emergency types of situations. When there's a more acute thing, let's say an animal eats a toy and it gets stuck in the intestines and has to be removed, or if they have pneumonia and can barely breathe. So you need that traditional medicine in order to take care of that. But once the damage is, or the fire is extinguished, so to speak, then you have to rebuild the house. And so that takes a little bit more than most people are aware of. It's not just a quick fix. It's not just instead of using aspirin or some other pain medication and using an herb instead. It's really kind of looking at what is actually causing it. Why is the animal sick, which is something that is not really asked in the traditional world. So we ask why, what are the things that can cause disease? And there are really 2 causes for disease. One is a deficiency of something, and the other is an excess of something. And deficiencies, usually it's nutrients, possibly vitamins, not enough exercise, not enough hormones, those types of deficiencies. And then also with the excess, we live in a polluted world, so we have a lot of toxins. So those would be kind of the 2 main things that really cause the disease. And the way it does that is it creates a malfunctioning of cells, because if the cells don't get what they need, or they're bombarded with things that are toxic to them, they don't function well. And if cells don't function, then that's disease. And it's really that simple. And as doctors or veterinarians, we always have these big words of, diseases, but in the end, it's really all the same. It's just malfunctioning of cells. And if it's the pancreas that malfunctions, then we end up more with diabetes or EPI. If it's the GI tract that malfunctions, we have diarrhea.
Can I ask you something? You said the beginning of all disease is either an excess or a deficiency.
Or both.
And how does that play with inflammation? Would that be also an excess? Because a lot of people say that that inflammation or chronic inflammation is the root cause of all disease. Would that be an excess, or?
Well, it's really more the result of the malfunctioning cells. Because then the immune system is trying to clean it up, and anytime the immune system gets involved, you have inflammation happening. And so if the immune system can't clean it up, or there's constant insult, then it becomes more of a chronic thing, which, we don't want, because chronic inflammation causes damage overall, because it constantly makes cytotoxins, in the attempt to heal the body. So a little bit of inflammation is good. If you hit yourself, for example, you want to have inflammation in that area because it helps to heal the process. But if you have chronic inflammation, it just continuously is there and produces chemicals that are actually toxic to the body and will then damage other organs and such,
Okay.
Yeah. Does that make sense?
Yeah.
Okay.
Yeah.
Anyway, so inflammation is more the result of the imbalance or the malfunctioning of the cells.
Okay.
So because we know that all diseases are malfunctioning cells, the principles of restoring the function to those cells is very similar for most diseases. And that's where the 6 pillars of health come in. Because for one, you have to give the cells what they need. So nutrition is very important. So if you feed your dog, your cat, yourself junk food, that's what you're going to get. You'll get a junk body, basically. Yeah. It can't work, because the cells do need the nutrients that they need in order to function. So that's why nutrition is kind of the foundation and certainly number one of the pillars, because you can't build on you can't heal the body if you don't have nutrition in place, basically. So nutrition is the first one. And then the second one is GI health. Because I see a lot of dogs with allergies and, a lot of inflammation, and a lot of inflammation comes from the gut. So we want to heal the gut. So any animal that comes to me, I just assume that they have gut issues, because it's that common. And gut health is important for the brain to function properly, for the muscles to function properly, to decrease inflammation. Because anytime we have leaky gut going on, it creates inflammation in the entire body, which then affects everything. So gut health is very important. And usually I work on gut health with food to begin with, and giving the right food, so that we don't have bacterial overgrowth and yeast and that sort of thing. And then enzymes and probiotics. And my favorite is fecal transplants. I know it sounds gross, but it's probably one of the most potent medicine that I've come across. If you have a good donor, that is. And then once the gut is restored and nutrition is in place, I usually move on to detoxification, which would be the third pillar. Because we live in a polluted world, and as I mentioned earlier, one of the causes for malfunctioning of cells is toxins, and so we need to remove these toxins, get them out of the system, and so we want to do that. But in order to detoxify the body, we have to have a certain amount of stability to build on, which is where nutrition and GI health comes in, because we want to have a body that can handle detoxification. Because we can make an animal very sick if we just detoxify when it's not, stable enough, basically. So detox, I usually use a lot of herbs and binders, toxic binders, because anytime we go into detoxification, we mobilize toxins from wherever they're hiding and being stored. And then we try to move them through the kidneys and the liver, but we then also have to get them out of the system. Obviously, if it goes through the kidney, it goes in the urine, not a problem. But through the liver, it goes into the GI tract. And if we don't have anything to bind these toxins in the GI tract, they can get reabsorbed. And then you just have a recycling of toxins going on. Mm-hmm. So it's important to mobilize, to get them detoxified, but then also to get them out of the system, or get them transformed would be the second step. Because, toxins usually have to be transformed in the liver so that they can then be eliminated. Because most toxins are fat soluble, and the way they're excreted is as a water soluble toxin. So the liver converts that and then gets it out of the system. So that's detoxification, the third pillar. And then the fourth, fifth, and sixth pillar can be interchanged. There's no real succession. One would be hormones. Hormone health is important. Actually, hormones I would probably also put in with the first three, because, for example, if you have a dog who's hypothyroid and not making enough thyroid hormones, that would affect how they process food, how their GI tract will heal, and how well they're able to detoxify as well. So hormones is probably also kind of part of the initial workup, finding out what's going on with the hormones. Are they low? Are they high? How can we help?
Would there be a test for that we make, or that we do with our pets, or?
Yeah, for thyroid, for example, we can do thyroid panels that will tell us how much thyroid hormones are present and if we need to substitute a bit. And then adrenal hormones can also be tested because a lot of, especially allergy dogs tend to have a little bit of adrenal deficiency as well. So they can benefit from a little bit of adrenal support. So definitely hormones, can be tested for and then treated as well. Obviously with, removing the sex organs, estrogen, progesterone, testosterone through spaying and neutering, that is a little more difficult to replace. But, we can use glandulars and things like that as well, just to help support the body. The nervous system is another pillar, also often used from the start, because the body's communication goes through nerves. At least that's one of the communication systems of the body. And if the nervous system is not working properly, the end organ that is receiving the information cannot work properly. So I always say that nerves are a bit like a water hose. If you step on the water hose, there's no water coming out. And if you take the foot off, you have flow again. And with the nervous system, it's the same thing. If you have a little bit of a tight muscle somewhere, it can put pressure on the nerve. And then as a result, that area of the body is not going to be innervated as well. And that goes for the muscles, the tendons, ligaments, bones, hormone glands too, actually, because they also get input from the nerves. So for example, with the thyroid, sometimes I see that one side of the thyroid is not working as well in a dog. And then usually I find a little something going on in the neck that just impinges a bit on the nerve input into the thyroid. So if I fix that, then the dog has a little bit more energy again. That, for example, or the kidneys. I remember a cat that I was working on who had kidney failure and was urinating a lot, and so I did a little bit of chiropractic work to restore nerve flow or improve nerve flow to the kidneys, and the next day the cat's urine amount was normal. This doesn't mean that the kidneys didn't still have a problem, but it just helped to improve the function and the ability for the kidneys to function properly a little bit better. And of course it helps with dogs that are paralyzed and have back issues and so on. And also it helps to prevent injuries and arthritis down the road. And that's something that most people are not aware of, that we do have to maintain the body's function a little bit better in that regard, because arthritic changes, they don't happen overnight. They're more of an archaeological finding. By the time you see arthritis in an animal's joint, it's already been going on for years. So that's why I recommend doing some form of manual therapy, be it chiropractic work, osteopathy, whatever is available, massage, to really maintain the body's fluidity and ability to move. Because when a dog comes in with weakness in the rear end, sure, we can still help maintain that so that it doesn't get a whole lot worse, but there's not a ton of reversing really that we can do because the damage has already been done. So I always recommend to do preventative care and kind of like a car. I mean, we do maintenance on the cars, so I think we need to do more maintenance on our animal friends as well, so that they can have a good life and less pain down the road. Because the problem is that they end up with a lot of pain, and then you have to, possibly end up using drugs because you want to give them quality of life. So that's something that you can start way, way, way early in life, just like with everything else that we just talked about as well. But that's certainly important. And then,
how about hydrotherapy? Would that also be part of what you just talked about?
You mean like an underwater treadmill, for example? Yeah, that can help because just like for us humans, it's helpful if we move correctly. Because a lot of dogs, especially the bigger breed dogs, they don't use their core muscles as much. They propel themselves forward more with the legs. So doing exercises like underwater treadmill or balancing balls and those types of things help them to be, get a little bit more body awareness and use their entire body rather than only parts of it. So they certainly will, benefit from that. And that really goes into the last pillar, which is fitness and exercise. For one, they need to move. One of the speakers today just said that dogs in America, anyways, they get an average of less than 15 minutes of exercise every day.
Wow.
And that's way too little. They need at least an hour walk. I mean, it depends, obviously. If you have a really old dog, you're not going to go chase it around. But they need exercise. They need to move. It's good for their mental wellness as well. And it also helps to maintain muscle mass, because that, again, is very important to maintain stability in the joints, so that they don't end up with arthritis down the road. So exercise is definitely very important. And also the kind of exercise, just what you, suggested, underwater treadmill or other kinds of exercises to help them, achieve better balance, is important as well. And mental stimulation is really important, because a lot of dogs, especially, for example, the herding breeds, they need a little something, because otherwise they go crazy. They need some mental stimulation. So definitely fitness and exercise is really, really important, because it increases blood flow to everything, and then everything works better. And I think, even though we talk a lot about nutrition and all of these other things over the last year or two, I've kind of started feeling that exercise is probably almost even more important, just because it keeps things moving. And the reason I got to that is because I see some people in my environment who exercise a lot because of their profession. And let's just say, I wouldn't say that their diet is up to my standards. And they are certainly a lot more healthy because they exercise. And the same goes for dogs. They need to exercise a lot. And I don't know, have you guys seen the story or read the story of that 30-year-old dog in Australia? I can't remember her name now. Maggie?
Yeah, Maggie, yeah.
And that's because she was running 10 kilometers one way and then 10 kilometers back every day. So she moved constantly, And I think, fitness and exercise is definitely very important. So those are the 6 pillars, and they really need to all be in place, because if you leave, any of those out, you're not going to achieve as much of the longevity as you're looking for, basically. So it's really more of a lifestyle change in many cases, or a lifestyle upgrade in a sense. But that's really what it takes. It's not just a one little herb or one little homeopathic remedy or one little acupuncture treatment that is going to turn your animal's health around. It really takes more than that. And if you start early with everything, then you have a dog that lives a longer life and is healthy, and then, dies. Instead of having a dog that just kind of keeps declining and being in a lot of pain for a lot of years and suffering. So it's important to integrate all of these, because it will also bring joy to whoever has the dog, because when they suffer, we suffer, right? So,
and the other way around.
Yeah, exactly. Yeah, that's true. Yeah.
I have 2 questions. So let's say us as raw feeders, we already, all right, so us as raw feeders, we already do fulfill some of these pillars. So we do the raw feeding, we exercise our dog, and where would somebody like us, we do detox once a year, our dog, but I'm sure we can talk a lot about detoxing as well. But as far as the hormone goes and the other things that you've mentioned, would that be something that I would now, as a raw feeder, and maybe other people who might have the same questions, where do we go from this? I already do these 3 pillars. Do I now have to go to the vet and check the hormones and see where I can fulfill the other 3? Or
Well, hormones, usually I test those if I have a suspicion that there's something off. If you come in with a young dog that's full of energy and everything, I'm not going to check for hormones. hormone levels, because I'm not trying to waste people's money either. But let's just say I have a really old dog who's, or maybe a middle-aged dog who doesn't have the level of energy I think he should have, is overweight, has a lot of allergies that just don't quite resolve with the usual protocol I use. I will definitely check hormone levels, just to see where we're at and how much support they need.
What are the other two pillars again?
Nervous system.
Okay.
So that would be more manual therapy, and I use chiropractic work and a little bit of craniosacral therapy as well, and then visceral manipulation, which kind of works more on the ability of the organs to move freely within the abdominal and chest cavity, and also the fascia that connects everything, because most animals have some scar tissue somewhere and some inhibitions of free movement, even if they haven't really had any surgery. They can benefit from that because it kind of frees things up.
Okay, so to summarize, if there's a pet parent who feeds raw, who exercises their dog regularly, does detox once a year, and we know that the microbiome or the gut, there's no gut issues, then we pretty much fulfill all the 6 pillars until we see problems with our dogs. Like that is when we would then go and get our hormones, the dog's hormones checked and the nervous system checked.
Well, the nervous system, that's something I would do on a regular basis. Like for example, I go to the chiropractor once a month, just for maintenance. Even if I don't really feel like I have an issue, he always finds a little something that can be adjusted. So it's more maintenance, so that you don't kind of slowly go downhill. Kind of like a car, you do oil changes every so often if you don't forget. That's something that I would put on the maintenance plan.
Okay.
Yeah.
That is interesting.
Yeah.
Okay, and then the other question that I had, I thought it was interesting that you said first comes the diet. Like if we're talking about a dog that's on dry food right now, and they're having problems, and you're suggesting to go up the ladder with the 6 pillars. So we would start with raw food and then detoxification.
Yeah, first I want to put them on the diet that I want them on, that is going to provide them with the nutrients that they need in order to be able to detoxify. Because if they don't have the nutrients, they can't. It will just mobilize the toxins, but it will just kind of keep them in the body and make them actually feel worse. Because toxins are usually, and most toxins are fat soluble. So what it does is these toxins just get stored away in fat, and they're out of the circulation and sort of safe in a way. They're not making them super sick. But if you're actually mobilizing these toxins and getting them out of the fat, you need to get them out, because that makes them sicker if they don't get out. So if you try to do that without having the proper nutrition in place and the body actually being able to handle these, because for example, you're mobilizing all the toxins and they end up in the bloodstream, but the liver is not working properly to get them out, then the dog is actually going to be more sick. And depending on the condition of the dog in the first place, you can really crash them. So the dogs that I detoxify, they usually don't have any problems with detoxification. They don't get diarrhea. They don't start throwing up. They don't feel, mopey and so on, because I already prepare them well so that they can handle it. So nutrition and GI health is really important, because a lot of the microbes in the GI tract help with detoxification. So you want them, to be present in the right numbers and species, and, you want to have a good microbiome, basically.
When do you say is the best time to start with the detox after you switch to raw?
Well, it always depends a little bit on how an animal is feeling, but usually I switch them to raw And then 2 weeks later, I usually do a fecal transplant depending on what they need. And then 2 weeks after that, usually. Yeah.
All right. Interesting.
Yeah. And I do recommend detoxification twice a year, generally, in the spring and the fall, just because we have so much toxicity going on. And the body just needs a little more help. But even just raw feeding, you can always add some herbs and you know, like a little cilantro or a little bit of parsley, or, you know, some of the herbs that you can buy at the store, dandelion greens, for example. And that helps with detoxification all year round a little bit, you know, because I think that's really important to, you know, so if you're already doing a lot with just the raw feeding. Yeah.
Yeah, we use a lot of parsley in our food. Are there any specific ways that you would suggest we detox our dog twice a year, like any specific products or herbs or?
Yeah, I use herbal tinctures from my company called Five Leaf Pet Botanicals. They have like a 3-week protocol where for 2 weeks it's more the cleansing is more focused on the liver and the blood, and then the 3rd week it's more focused on the kidneys and still cleaning out the blood too. And then it comes with some greens as well that help to bind some of these toxins and add more nutrients. So that's the one that I use, but it depends on the animal. You know, there's some other things as well. This is sort of the protocol I use for all of my patients. Obviously, I individualize it a little bit, you know, depending on what's going on, but this is really kind of the foundational aspect of it, you know, be it allergies, be it cancer, autoimmune diseases, etc. You know, for some diseases, obviously, I have to amp up the protocol, you know, with adding more things to support. But you know, that's really the foundation. You know, so a lot can be done this way.
Yeah,
for healthy and for sick animals.
Thank you so much for sitting down with us and speaking about longevity in dogs. If our friends on the internet would like to find you, where could they find you on?
Yeah, I do have a little presence.
Yeah.
I try. Well, I have a website. It's Peak Animal Health Center. Peak as in Mountain Peak or like Peak Health.
Yeah.
PeakAnimalHealthCenter.com. And then I have my book, What Your Vet Never Told You. I'm on Facebook as well. It can be found there. And I also have a video series where I go into a lot more depth on these pillars, including also vaccines, heartworm. Just, you know, to really give people an in-depth education that is really kind of at the veterinary level almost.
Awesome.
You know, so that you guys are informed, you know, because that's really the important part is education.
Yeah.
The more you all know, the better, you know, and the easier it is for us to work with. But that way you can also challenge your veterinarians because you actually know what, you know, what you're talking about.
Yeah.
Because I think a big problem in this world is that, you know, veterinarians can have a tendency of overpowering their clients. Yeah. Maybe not, you know, not maliciously or anything like that. So it's good when people are informed because it makes them a better partner in their health care for their animals and also more interesting, you know, to work with because, you know, we get good questions and you guys also help us. You know, sometimes they come up with things that I didn't think about and that's really helpful, you know, and then I got to go dig in and, you know, do a little more research on certain things. So,
it's really cool. I think, I mean, resources like yours are really important for pet parents everywhere because like we always say, we mentioned this so many times, pet parents should not be afraid to ask as many questions at the vet office as they would like because it's our dog, it's our decision at the end if we go through with the treatment or not. And it's okay to say, I respect your suggestion to do this medication treatment, but I will go home and I'll research and then I'll look at the resources that other vets put out and educate myself, and then I can make an educated decision if I'm going to go through with it with my dog.
Right.
So I think it is amazing when vets like you do put resources out like that. Yeah.
Well, and I want people to know that they can say no, you know, and that they should be able to say no, you know, no matter what vet you are. I want my clients to question me. I want them to be critical. I also want them to do what I recommend, but if they don't feel comfortable with it, I want them to feel free to say no without feeling like I'm gonna, you know, put them down or you know, throw them out or whatever people are afraid of. You know, I want people to be free to, you know, take responsibility for their animals and be responsible and not transfer that responsibility to the vet, you know. So it's kind of important. I've also had a lot of people who have watched my video series actually start changing their own lives, because it's all the same, no matter whether they're animals or humans. You know, the principles are the same. And so that's been really nice, you know, to also see the changes in the people who kind of go with those 6 pillars and change their lives, you know, together with their animals. So
it was the same thing for us when we started feeding our dog better, and our dog all of a sudden was only eating organic. We were like, hold on, like,
what about us, right?
What about us? So we completely changed our nutrition as well, and we feel it. Like, we feel such a big difference. So awesome. And now we haven't been eating meat as well since we like dug more deeper into like mass production and all of that stuff. So we try to get only clean meat for Milka, but we also said, okay, let's just, for us, we don't really need meat to survive, so she can eat the meat and then us. And we feel a very big difference.
Oh, that's so awesome. Cool.
All right. Thank you so much for sitting down with us today and giving us a great insight into what we can do to make our dogs live longer and have them with us, as long as possible.
Yeah, no, thank you. It was a pleasure sitting down with you as well. And thanks for all the hard work that you do and spreading the word. It's
Thank you.
very touching.
Thank you.